Express satisfaction at how the start of phase 2 of the national COVID-19 vaccine rollout proceeded yesterday. In a statement, Minister Zweli Mkhize says, while there were some challenges, including Eskom's current stage 2 load shedding and protests in provinces like the Free State, the vaccine rollout proceeded reasonably well. It is expected that the total number of people who got their jabs yesterday will be announced once all of the figures from more than 80 sites have been reconciled. That should happen later today. Meanwhile, having a look at the latest statistics released by the department, another 1,757 new coronavirus infections and 50 deaths were recorded in the last 24-hour cycle. And the number of active cases is now sitting at 33,587. Let's welcome to the show Dr Angelique Coetzee, the chairperson of the South African Medical Association. Good to have you. Thanks so much again for being with us, Doctor.
Thank you, and a good morning to all your viewers out there.
Yeah, so day one of phase 2, obviously a slow start. We were warned by the minister that, initially we would see it start off very, very slowly and then gain momentum as we get more sites. But let's have a look at yesterday. How is your analysis? How do you feel it went?
Well, obviously, SAMA welcomes the start of our vaccine rollout. It's long overdue. So we also acknowledge the multitude of challenges in our specific settings that we are having. But I must say most disappointing after nearly 6 months of planning is the tiny number of sites we have started with. And then most concerning is the lack of computerized record keeping. You see, how hard would it be to implement at every site, especially in the public sector, just 1 or 2 laptops? Yeah, we hope that the Department of Health and its partners will be able to rapidly upscale this vaccine administration. As per their stated narrative of reaching 40,000 people per day, but we know that we are unable to vaccinate 10%, that if we can't vaccinate nearly 10% of that number, we will always be behind the numbers and the curve in terms of protecting our population. Some will continue to question the rationale of not opening up distribution and administration as widely as possible. Mm-hmm. And we hope that the department at some point acknowledge that they lack the capacity to do this without extremely wide-reaching partnerships, most notably with the GPs of South Africa. What is also concerning to us is that we heard from our KwaZulu-Natal doctors that there was a power outage. Now, what we cannot understand is that if you as a GP or a pharmacy in the private sector wants to be part of this vaccine rollout sites, there's very, very strict regulations that we need to adhere to. So now, why is this not part of the public sector? Surely we cannot have 2 different rules. To have paper-based data, as we have seen yesterday, in clinics, or especially in the public sector hospitals, where there is not enough computers. How on earth is this happening?
It's a big thing. And I mean, you talk about the load shedding and you talk about no power supply, whereas we know that at the moment the vaccine that's being administered is the Pfizer vaccine. And this, of course, has a very, very strict cold chain that is associated with it. I mean, storing at minus 20 degrees and obviously has to be kept very cold once it is cracked open to administer it. So, I mean, these are big problems. And like you say, there has been enough time to prepare for this, but from what you're noticing, is this it's just not good enough?
Yeah, definitely. For us in the private sector to be able to distribute and to have the vaccines in our surgeries, there is really very strict recommendations that we have to adhere to. Now, why on earth is that not happening in the public sector? And by the way, why are there not enough generators in the public sector? So the lack of power outage should not be that big a concern in the public sector. They're supposed to have emergency generator backup. So this brought a question to mind: what is happening there?
You know, even the numbers that we saw when the minister announced it on Sunday night as to the amount of people that are going to be vaccinated, and but this was for me a bit of alarm bells ringing off as he was making this announcement on Sunday night, and then said, as I speak now, people are getting their SMSs. This is Sunday night. They are now expected to be at a vaccination point the very next day. Now, not everybody has the luxury of being able to get to that vaccination point at such short notice. It just seems that this is perhaps a little bit of last minute. But maybe I'm wrong. But I know of people that were getting the SMSs in the morning and then quickly had to cancel their entire work days to organise for their parents or grandparents or themselves to get to a site and then stand there for maybe 6 hours minimum sometimes. And we're only talking about, the minister announced it. I mean, I think the numbers that we were looking at were about 4,200 over 60s and 7,700 healthcare workers. That was yesterday. Not sure what the final number was, but I mean, this is a drop in the ocean if we're starting at this pace.
I fully agree. That's why we can't even speak about a national mass rollout, because this is not a mass rollout. And again, we don't have the numbers of how many people were actually vaccinated yesterday because of the paper-based system that was used. Also, a bit of a concern to me is I noticed last night that, you know, I know the press and the media, everyone wants to take pictures and look at the sites, but there was quite a few pictures where the minister and other dignitaries standing in a very small room, no social distancing. It looked like a crowd in a room. We cannot send that out. We keep on saying, please, social distancing, masks, all of that. And then that appears in the media. We cannot. It defies the purpose of us trying to get people to have safe distances. And also on the elderly people, you know, for a person 20 or 30 years old, you tell them to be at a place 10 o'clock this morning is not a problem. But tell that to a 70-year-old, this is a huge thing in their life. And as you said, you know, some of them can't on their own get to these sites. You cannot the night before send out messages encouraging people to be there the next day. I've also had a lot of questions yesterday from my own patients, elderly patients, that's asking me, Doctor, I haven't received anything.
Yeah.
All I can say to them is just wait. And it's wrong.
Yeah. We've been receiving very similar inquiries this morning from people saying, you know, I registered, my parents have registered, but we've gotten no communication. So hopefully we'll see things being ironed out as the process does pick up momentum, and it can but only pick up momentum, because I believe that there are a lot more partners that are coming on board. I suppose we were hoping that this would already be happening at the different vaccination sites, the private partners, whether we talk about a Eskom or your local pharmacies or these kind of partners coming into the fray, and this is where we actually see the speed starting. So is that where you are also pinning your hopes a little bit, that we can actually see more happening there?
Well, yeah, we are hoping, but you have to understand it's 6 months later. This date was announced not by us, but by Department of Health. Surely by now everything should have been in order. But there's another problem that I need to make people aware of. We're still waiting for FDA approval for the Johnson & Johnson vaccines that's lying in PE or Gabberta. Once if we have that, we will have more vaccines. So for now, we have around about 1 million Pfizer dosages. It means we can only vaccinate 500,000. So we need to look at extending the second dose from 21 to 42 days help us. Hopefully, the government will then be able to get a second dosages for Pfizer into the country. But it is a problem. So even if we have 40,000 people today to be vaccinated, we are going to run out of vaccines. So it is a problem.
Yeah. We heard from, there's been the talk of the fact that now we have got the double shot Pfizer, as you mentioned. So we've got the double shot, which we've been under the impression that it needs to be at 3-week intervals. But now I heard the minister on Sunday night mentioning possible 6-week interval. Do you know anything about that?
Yeah, it is because we're trying to stretch the vaccine so that you can have a million people with first dose, trying to then get them 42 days later for the second dose, and hopefully we will get more vaccines in from Pfizer, because it must be Pfizer. Otherwise, we don't get more vaccines in within the next 40 days. We are stuck.
Then the first batch that's been administered is actually going to be a waste. But pushing this to 6 weeks, have other countries pushed it that far?
There's only one study from Britain where they looked at 3 months or 12 weeks and said that in the 80-year plus, their antibodies was actually much better.
Okay.
And it did it in it didn't. It had an influence on their antibodies, but that is a study over the age of 80. We don't know.
Yeah. So it's a bit of a risk at this stage. It really is. But all right. So that's phase 2, and we're hoping that things will, of course, improve when it comes to this. And we see lots of partners coming on board. We see the Johnson & Johnson being cleared, because we do know that there are doses to be rolled out, as you were mentioning. But, in general, Prof, I can hear a little bit I can sense a bit of disappointment to the kickoff of phase 2. But are you hoping as we progress, things will get better?
Well, I have to have hope. Because if we don't have hope, we are going to be in deep trouble. So I can just pray, and at this stage, just ask people to register. Please register, so that we know how many doses we need and where you are, so that we can work out the logistics of sending out to those people WhatsApps and SMS for their to come to this certain site. Because the department said that your site would be in your area. That was another problem that I heard from my patients asking, Doctor, does now mean I need to go to Joburg, or do I now need to go to Mamelodi, or where do I need to go? So that is confusing. There's not enough data.
Yeah, it certainly has. That appears to be it, and also perhaps unrealistic goals. I mean, with the department saying 5 million senior citizens targeted to be completed by the end of June, whereas we look at the Sisonke trial that started in February, it ended over the weekend. We only managed 478,000. We didn't even get to the 500,000, but yet we expect to get to 5 million by the end of June. Do you believe it's attainable?
In the perfect world, it will be, but we're not living in a perfect world.
No, unfortunately we aren't. Let's leave it there for this morning. I hope the next time we speak, things are looking a bit better. That's the chairperson of the South African Medical Association, and unfortunately not a laughing matter, but these are serious things that are taking place. Dr Angelique Coetzee discussing how the first day of the country's mass vaccination program proceeded. Not too happy, but hoping things will improve. Quick break. We'll see you after this with the news at 7.